I'll start with the cataract portion first. So our eye functions like a camera. So light passes through the lens to focus on the retina, which is a layer of light-sensitive cells at the back of the eye. The image then gets transmitted to the brain. So cataract is a condition in which the natural lens of the eye becomes cloudy. It is the most common cause of blindness in the world. Cataract reduces the amount of light entering the eye, causing blurred vision. So aging is the most common cause of cataract. Other causes include UV exposure, smoking, heavy alcohol intake, diabetes, certain medications like steroids, trauma to the eye, chronic inflammation, and some children are even born with cataracts. So what are the symptoms of cataract? So gradual blurred vision or cloudy vision that cannot be corrected with glasses. You may also experience poor night vision. The colors may seem faded, and there may be a yellowish tinge to your vision. As the cataracts scatter light in the eye, you may also notice glare, as well as a frequent change in your glasses prescription. So can you slow down the progression of cataract? Cataracts usually progress slowly. To slow down the progression, do wear UV protection when you're out in the sun, stop smoking, limit your alcohol consumption, control your diabetes, and eat a balanced diet comprising of leafy vegetables, fruits, whole grains, nuts, and fish. If you have been diagnosed with cataract, you may be ripe enough for surgery. Cataract surgery is generally a safe procedure, and cataracts do not need to be too ripe or dense before a patient can go for surgery. In fact, the risk of surgical complications increases if the cataract is too dense. So these are some questions you can ask yourself to determine if your cataract is visually significant. Is your vision blurred? Is it getting difficult to carry out your daily activities like cooking, taking medications, walking up and down the stairs? Do you find it difficult to drive, especially at night? Are you having problems reading or watching TV? If you've answered yes to any of the questions, do discuss with your ophthalmologist about cataract surgery. So benefits of cataract surgery include improved vision and improved quality of life. So with better vision, you get to do your daily activities better and appreciate the fine details in life. Another benefit is safety, as you have better depth perception, be able to navigate up and down the stairs more safely and drive more safely. So how is cataract surgery done? The cataract is removed and replaced with an artificial lens implant. The common types of cataract surgery include phacoemulsification and femtosecond laser-assisted cataract surgery. I'll show you a video on phacoemulsification.
2 millimeters at the junction between the cornea and sclera. The intraocular lens will be inserted through this incision. Then 1 or 2 additional micro-incisions are made to enable the manipulation with surgical instruments. Next, the surgeon applies a jelly-like transparent substance called ophthalmic viscosurgical device, OVD, inside the interior chamber. This substance protects the internal structures of the eye and creates space for the surgeon to manipulate with the surgical tools. Then, the surgeon carefully opens the capsular bag where the lens is located and creates a round, continuous opening of approximately 5.5 millimeters. This opening allows removal of the cataract lens without removing the capsular bag. Using an ultrasound probe, the cloudy lens is broken down and gently removed via suction, leaving a clear capsular bag. The red color that can be seen after the removal of the cataract lens is a result of the reddish-orange reflection of light from the eye's retina. Finally, the clear artificial lens is implanted using an injector. The intraocular lens unfolds gently into the capsular bag, replacing the removed natural lens. The implanted intraocular lens stays fixated and centered in the eye and is neither visible nor perceptible. The incisions are self-sealing.
Okay, so femtosecond laser-assisted cataract surgery uses femtosecond laser to replace some of the manual steps of cataract surgery. The benefits include creating a more circular hole in the capsular bag with better intraocular lens centration and stability. It also softens the cataract and reduces the amount of ultrasound energy used for cataract removal. This reduces the risk of surgical complications in some types of cataracts.
Catalyst, your surgeon can use the laser to make the corneal incisions with exceptional precision. Moreover, your surgeon can create the circular opening with the exact intended size, shape, and location using the precision of the laser. With Catalyst, your surgeon can also use the laser to soften the hard cataract and segment it into manageable pieces before ever entering inside the eye with instruments. Shown here is a Catalyst laser grid pattern.
What are the types of intraocular lenses? So that include monofocal lens, multifocal lens, extended depth of focus lens, and toric lens. I'll first explain about the different visual zones. The near zone consists of objects from our eye to 60 cm from our eye. So everyday activities using near vision include using our handphone, reading books, looking at a menu, looking at prescription bottles, and sewing. The intermediate zone consists of objects between 60 to 100 cm from our eye. Everyday activities using the intermediate vision include using computer or the laptop, looking at a mirror, using the GPS, and cooking. And distance zone include objects further away. So everyday activities using distance vision include looking at the street signs, watching TV or movies, looking at the board in front of the classroom, and outdoor activities. So the monofocal lens, this lens enables good vision for one zone, either distance, intermediate, or near. And glasses are required for the other portions of your vision. Most people opt to be clear for distance vision, so reading glasses will still be required for intermediate and near work. This lens gives us the best quality of vision with the least amount of glares and halos. So the pros of this lens: crisp, clear vision for one vision zone, is least likely to have glares and halos. The cons is that you require glasses for the other vision zones. Okay, so the image on the left shows a simulated vision through a cataract. You can see that the image is blurred, okay, and the colors are washed out, and there's a yellowish tinge. The image on the right shows simulated vision through a monofocal lens. So distance vision is clear, okay, but intermediate and near vision is blurred without reading glasses. Multifocal lens. This lens enables good vision for distance, intermediate, and near without glasses in majority of the patients. Some people may still need glasses to read fine print. You need good lighting to be able to read, and this lens may be associated with glares and halos. It's only suitable in some eyes. It is not recommended for people with vision loss from glaucoma, macular degeneration, and other eye diseases. And this lens requires a period of adaptation. So the pros: it decreases spectacle dependence. Cons, there may be glares and halos, and there's also a decrease in contrast sensitivity. So this image shows simulated vision through a multifocal intraocular lens. Okay, so the distance, intermediate, and near vision is clear without additional glasses. Okay. And this image shows a simulated vision through a multifocal lens at night. So there may be associated glare and halos, and night driving may be affected. Extended depth of focus intraocular lens, or EDOF lens. This lens aims to provide two zones of clear vision, distance and intermediate. Reading glasses are still required for near work. This lens is less likely to have glares and halos compared to the multifocal lens. And it also requires a period of adaptation. So the pros of this lens: decreases spectacle dependence for intermediate vision, less glares and halos compared to the multifocal lens. The cons is that you're still required to use reading glasses for near vision, and you may still have glares and halos. Okay, so this image shows vision through a EDOF lens. Okay, so distance and intermediate vision is actually clear, but near vision is blurred without reading glasses. There's less glare and halos compared to the multifocal lens, as you can see. Okay, the toric lens. This toric lens is for correction of regular astigmatism. With astigmatism, the cornea is not uniformly curved, resulting in distorted vision, okay, for distance, intermediate, and near. The toric lens may not correct astigmatism fully, and this lens is associated with a risk of lens rotation after the surgery. If that happens, you require another operation to reposition the lens. Toric options are available for multifocal, monofocal, as well as the EDOF lens. So the pros of this lens: it provides crisp vision for astigmatism, decreases the reliance on glasses. The cons is that there's a risk of lens rotation. So the factors to consider when choosing the type of lens: do you have any other eye diseases? Multifocal and EDOF lens are not recommended for people with vision loss from glaucoma, macular degeneration, and other eye diseases. Consider your lifestyle and work needs. Do you like wearing glasses? Do you spend a lot of time working at a computer? Do you frequently drive at night? Can you tolerate glares and halos? So it's very important to understand the pros and the cons of every lens, as there's no perfect lens. Every lens comes with its own compromise, be it spectacle dependence, glares and halos, or a compromise in the vision quality. So please discuss with your ophthalmologist which type of lens is the most suitable for you. If you're 45 years and above, do schedule cataract screening to pick up cataracts and determine the best treatment option for yourself. I'll move on to the glaucoma portion. So glaucoma is an eye disease that's often associated with raised eye pressure that causes damage to the eye nerve. It is a leading cause of irreversible blindness worldwide. Asymptomatic in the early stages, it is often undetected until there's extensive visual field loss. Hence, it has been called the silent thief of sight. Glaucoma blindness is preventable if detected and treated early. What causes glaucoma? Aqueous humor is a fluid that's produced in the eye which provides nutrients to the eye and maintains its shape. Fluid is continuously being produced and it flows out from the drainage angles. There's a delicate balance between the fluid production and drainage. So glaucoma is caused by a buildup of fluid within the eye when the drainage system is not functioning properly, resulting in raised eye pressure and damage to the eye nerve. There are different types of glaucoma. Primary open-angle glaucoma is the most common type of glaucoma. So in primary open-angle glaucoma, the angles are open. However, the drainage system is not working properly, resulting in the fluid being unable to drain out properly and raise eye pressure and damage to the eye nerve. In primary angle closure glaucoma, the angles are actually narrow or close, so the fluid is unable to even reach the angles in the first place. Secondary glaucoma occurs when there's raised eye pressure due to an identifiable cause, such as uncontrolled diabetes, hypermature cataracts after injury to the eye, or due to inflammation. Congenital glaucoma occurs in children due to the drainage system not developing properly. What are the symptoms of glaucoma? Most forms of glaucoma develop gradually, and most people are asymptomatic in the early stages of the disease. So if you look at this image here, this is the vision of someone with early glaucoma. There may be mild peripheral visual field loss, and the patient may actually not notice it. So as the disease progresses, the visual field loss will get more advanced, okay, resulting in tunnel vision, blurred vision, and even blindness in end-stage disease. Acute glaucoma is more rare and occurs when there's a sudden rise in eye pressure. Symptoms include eye redness and pain, severe headache, nausea and vomiting, and seeing halos around lights. So everyone can get glaucoma. Certain risk factors put us at higher risk, and they include older age, high eye pressure, having a positive family history of glaucoma in first-degree relatives, being short-sighted, having high blood pressure, having diabetes, long-term steroid use, a previous eye injury, obstructive sleep apnea, and migraine. So unfortunately, glaucoma cannot be prevented. However, early detection with regular eye checks will allow for timely treatment to preserve the remaining vision. You should have an eye examination if you have a family history of glaucoma or if you have other risk factors for glaucoma. How is glaucoma diagnosed? So glaucoma is diagnosed through a comprehensive eye examination. So that includes a slit lamp examination, eye pressure monitoring, doing a gonioscopic examination to check the drainage angles, okay, optic nerve head examination, optic nerve head scan, as well as visual field testing. How is glaucoma managed? Glaucoma is a chronic condition that requires lifelong monitoring and treatment. It cannot be cured. Once the eye nerve is damaged, the damage is permanent and visual loss is irreversible. The aim of treatment is to reduce the eye pressure to a safe level to preserve the remaining vision. Your doctor will individualize the treatment for you and advise which treatment option is best. Treatment options include medications, laser, and surgery. There are different types of medications in glaucoma treatment. They reduce eye pressure by reducing the fluid production in the eye or increasing the fluid drainage. Eye drops are most commonly used and can be used long-term. They need to be instilled every day. Oral or intravenous medications are usually used for a short period of time to quickly lower the eye pressure. So laser treatment, selective laser trabeculoplasty, or SLT. This is a laser that causes changes in the drainage pathway to increase fluid drainage. This laser is suitable for mild to moderate eyes with primary open-angle glaucoma. This laser is very safe, and if it's effective, it can be repeated. 70% of the patients who undergo this laser achieve drop-free eye pressure control at 6 years with lesser disease progression. Another laser treatment in glaucoma is laser peripheral iridotomy. So this laser is used for eyes with narrow or close angles. A tiny hole is created in the iris, which allows fluid to drain to the anterior chamber and widen the angle. It reduces the risk of glaucoma progression and acute glaucoma in eyes with narrow or close angles. Transscleral cyclophotocoagulation, or TCP, is another laser for glaucoma treatment. TCP destroys the cells that produce fluid and hence reduces fluid production in the eye. It is effective in reducing eye pressure, but it may be associated with serious complications. Micropulse TCP is a newer laser with improved safety. but the eye pressure lowering is less effective than the traditional TCP. So moving on to glaucoma surgery, trabeculectomy is the most commonly performed glaucoma surgery worldwide. In this surgery, we create a channel in the white wall of the eye to provide an alternative route for the fluid to drain out. This surgery may be associated with serious complications, and intensive post-operative care is required in the first few months. Many eyes achieve good pressure lowering over many years. However, in some eyes, the eye pressure lowering may be less over the years. This depends on the severity of the glaucoma, the type of glaucoma, and the scarring response of the eye. So tube surgery is another type of glaucoma surgery. This device consists of a tube that's inserted into the eye to drain fluid out and a plate that's sutured onto the white wall of the eye. And this surgery may be associated with serious complications and is done when medications, laser, or other surgeries have failed, or if there's a high risk of failure with other procedures. In recent years, there's been a new group of glaucoma surgeries, or known as minimally invasive glaucoma surgeries, or MIGS. And this includes inserting a microstent or drainage shunt to increase fluid drainage. Compared to the conventional glaucoma surgery, these MIGS procedures are less invasive, safer, with faster recovery. I'm going to show you a video on the Hydrus implant.
Interno canal-based MIGS device designed to increase aqueous drainage. It is the first MIGS device to use a trimodal mechanism of action to treat areas of resistance that may inhibit aqueous flow in the eye. The Hydrus microstent acts to bypass a potentially obstructed trabecular meshwork by creating a direct pathway for the aqueous to flow through Schlemm's canal. Additionally, with its open scaffold design, the microstent provides for a gentle dilation of a potentially narrowing or collapsing Schlemm's canal. And because of its 8mm length and approximate 90-degree span within Schlemm's canal, the Hydrus microstent allows for access and unobstructed flow to the eye's numerous collector channels and network of aqueous outflow veins.
So this minimally invasive glaucoma surgery can be done as a standalone procedure or combined with cataract surgery. They can also be used in eyes that are intolerant of glaucoma eye drops. So this is another video on the iStent, which is another type of MIGS procedure.
FDA-approved iStent Inject W is one of the world's smallest medical devices known to be implanted in the human body. To help control the increased intraocular pressure associated with glaucoma, 2 tiny stents are gently inserted in your eye during your cataract surgery. Once inserted, you will not be able to see or feel the device. iStent Inject W works by creating 2 bypasses or openings between the front part of your eye and its natural drainage pathway to help restore your eye's natural ability to drain fluid.
Okay, so is glaucoma cured after glaucoma laser or surgery? There's no cure for glaucoma, unfortunately. Laser or surgery do not bring back any vision loss due to glaucoma. So laser or surgery are done to lower the eye pressure to reduce the risk of further vision loss. Glaucoma can still worsen with time, and some laser surgeries may work less well after a period of time. Some patients may require additional eye drops, laser, or surgery if the eye pressure is inadequately controlled. So I'll share a few cases with you. So patient A is a 57-year-old male. So he has a history of ischemic heart disease, diabetes, and hypercholesterolemia. He had right eye pain and temporal headache. He was seen by the family doctor and was initially told to have sinusitis. He was then referred to see me. So his right eye, the vision was blurred at 6/120, and the vision in the left eye was normal at 6/6. The right eye was injected. The cornea was swollen, okay, and hazy, and the pupil was mid-dilated. Now, the space in the anterior chamber in both eyes were actually very narrow, and on gonioscopic examination, the drainage angles were close. His eye pressure was very high in the right eye at 46, and that in the left eye was also high at 26. So this gentleman has a right acute angle closure glaucoma and left primary angle closure. So I quickly started him on topical and intravenous medications to reduce the eye pressure. He then underwent a left cataract surgery with intraocular lens implant, following which his left eye pressure normalized without any further glaucoma medications. He also underwent a right cataract surgery with intraocular lens implant. Unfortunately, his acute glaucoma attack in the right eye did not break, and I performed a right trabeculectomy surgery for him after. And following that, his eye pressure came down to a healthy range. And this is his nerve scan at the last review. Okay, so there's actually no damage to his nerve, okay, because we were able to lower his eye pressure in time. So patient B is a 50-year-old lady with no known past medical history. She was noted to have a visual field defect by her family doctor on testing. She actually did not notice any visual symptoms. Her vision was 6/7.5 in the right eye and 6/6 in the left eye. Her pressures were high, 24 in the right eye and 23 in the left eye. On gonioscopic examination, angles were open. Visual field testing actually showed a visual field defects in both eyes. So she actually has vision loss superiorly on both eyes that she did not notice. And on optic nerve heat scanning, there's actually thinning sin, which shows optic nerve damage. So she has primary open angle glaucoma. So she underwent laser SLT in both eyes. After that, her pressures came down to less than 16, and her vision and her visual fields remained stable. In summary, early glaucoma often has no symptoms, so it is important to go for regular eye checks from the age of 40. Earlier if there are other risk factors or symptoms. Early detection and treatment of glaucoma are important to prevent further damage to the eye nerve. With appropriate treatment, majority of the glaucoma patients will be able to retain vision in their lifetime. Thank you.